Hello, my name is Taylor DePlanchi, and I'll be presenting on the topic of renal failure. Renal failure is also known as kidney disease and can be broken down into two types, acute renal failure or chronic renal failure. Acute renal failure is also known as an acute kidney injury or AKI. AKIs are sudden and often can be resolved with treatment. Chronic renal failure is also known as CKD. CKD is typically developed over time and can be managed with treatment, but is not typically cured or fixed. There are several stages of kidney failure that is determined by the GFR, or glomerular filtration rate, and a physician or nephrologist will stage the kidney disease from that GFR level. There is also acute on chronic renal failure, where the patient has chronic kidney disease at baseline and there's an acute kidney injury on top of it. This may be seen when the patient has a baseline elevated creatinine or lowered GFR and it worsens suddenly. Prevalence, demographics, and risk factors. Per the Mayo Clinic, diabetes, hypertension, cardiac disease, smoking, obesity, increase in age, family history, and abnormal kidney structure are all risk factors of renal failure. The National Kidney Foundation has found that 37 million Americans are affected and many more are at risk. Vulnerable populations include African Americans, Hispanics, Pacific Islanders, American Indians, and seniors. Pathophysiology and causes of renal failure. The pathophysiology slide has been broken down into causes for both AKIs and CKD due to the many reasons why each may occur. The pathophysiology of the renal failure will be determined by the root cause. Per the National Kidney Foundation, the top two causes of renal failure are uncontrolled diabetes and hypertension. Causes of an AKI are decrease in blood flow. This may be seen in hemorrhage, shock, vasculitis, vasoconstriction, sepsis, etc., as well as hydronephrosis, renal obstructions such as renal calculi, and hypertension, nephrotoxic drugs such as that Lasix that we always give, and dehydration. Common causes of chronic kidney disease include hypertension, chronic glomerulonephritis, diabetes, polycystic kidney disease, blocked urinary tract, and kidney infection. Clinical presentations of renal failure. Both AKIs and CKD can exhibit similar symptoms. Per the Mayo Clinic, symptoms of renal failure include pulmonary edema, fluid overload or retention, electrolyte imbalances such as hyperkalemia, cardiac disease or event, bone fragility with or without fracture, anemia, decreased libido, decreased fertility, erectile dysfunction, central nervous system damage, which may lead to seizures, a decreased immunity, pericarditis, and end-stage renal disease. This overall might end in the use of dialysis or need a kidney transplant if not properly managed. Cultural considerations. Cultural considerations in decision-making and goals of care are the language barriers that some may face, not only physical, but with linguistics as well, body language, all of that. Religion and spirituality, mistrust. I know that we've all heard of in the past history, and I'm sure even in recent times, that there are certain populations that get taken advantage of in healthcare and that can harbor a lot of mistrust and potential hostility, which does not affect the provider-patient relationship in a positive way. There can also be The factor of family dynamics. Some cultures or populations have, the elder males make the decisions for the younger populations, or as well as cultural preferences and practices. Health promotion interventions, assessment tools, diagnostics, preventative tools. The Mayo Clinic says that preventative measures include avoid NSAIDs, non-steroidal anti-inflammatory drugs, maintain a healthy diet and weight, avoid nicotine and tobacco products, and manage chronic disease processes such as that blood pressure and blood sugar. Diagnostics include blood work, urine samples, renal ultrasounds, CAT scan of the abdomen, and renal biopsy. The National Kidney Foundation has stated that the GFR is the most useful lab when determining kidney function and staging of chronic kidney disease. Other labs that may be used in renal failure include protein measurement in urine, blood pressure, urine albumin levels, and serum creatinine. Education, self-management, and discharge. Lifestyle changes would include having a routine, adhering to a renal diet, which would be a low potassium, low protein, low phosphorus, low sodium, low fluid diet. Maintain a healthy body weight, exercise regularly, and take medications as prescribed, go to your doctor's appointments, ask physicians about over-the-counter medications, track the blood pressure and blood glucose if they have issues with that. Keep up to date with immunizations and with doctor's appointments. Coping and support. It's important to encourage your patients to seek out support with these, not only acute renal failure, but with the chronic renal failure, as it will change their life. So talking to a trusted family or friend, or referring to some sort of support group, can be helpful. With the discharge planning, it will refer to a nephrologist, have a follow-up appointment scheduled with the primary care physician, schedule regular lab work, provide resources such as government websites or foundations to get information on the disease process, as well as different outsourcing for like skilled nursing, all of that, and educate on symptoms of worsening disease or impending emergent situation as to when they should go to the emergency department, or if they need to call and make an appointment with their physician. In conclusion, AKI is an acute kidney injury, which is acute kidney disease, versus the CKD, chronic kidney disease. The top two risk factors of developing renal failure are uncontrolled hypertension and diabetes. The pathophysiology of renal disease is dependent on the cause, for which there are many. Be aware of cultural considerations when interacting with a patient, that is before, during, and after patient care. Educate the patient on self-management, follow-up, and preventative measures to avoid starting to have renal failure or worsening the renal failure. And the GFR is the most useful lab when determining renal function and staging renal failure, chronic kidney disease. These are the references for not only the information that I have provided, but also the images that were provided. Thank you all for listening to my PowerPoint, and have a lovely evening.